blessed morning to be alive. I want to say good morning to every one of us on this live show. It's a pleasure to have you connecting to us once again, to be a part of today's meeting. Today we are going to have a knowledge and perspective in menstrual period, challenged by Dr. Kemi Agoye. To every man that's chosen to be a part of this, I want to say a special thank you to you, because I know that you love us immensely. That's why you're connecting, and want to say that we love you as well. I'm Adetutu Afolabi. I'm a pharmacist by profession. I'm the boss lady of Wellness Healthcare Group, a wellness and personal freedom coach. I coach people on emotional wellness and emotional well-being. This webinar is one of the ways wellness is reaching out to everyone around us to promote the general well-being of our people. Wellness Healthcare Group is a leading healthcare organization in Nigeria with an unrivaled, professional, and flexible approach to ensuring that everyone enjoys seamless access to care. With our HMO platform, we promise our people with our responsive, empathetic, and our team has a kind of problem-solving skills that it's wow. We know there will always be problems, but we make sure we solve the problem. So if you're thinking of an HMO plan, you need to subscribe to Wellness. You need to subscribe to Wellness and enjoy peace of mind. You can also connect with Wellness in our community pharmacies located in Alaquera and Maryland in Lagos State. There we have pharmacists that truly cares. Today, I'm going to also welcome Mr. Joshua. Mr. Joshua, thanks for what you do. He's been our interpreter. He's given us the grace to have some group of people and include them in this webinar. Those people with special abilities. I want to also say thank you to them for joining the webinar. So, Mr. Joshua, thanks for what you do. So, Dr. Kemi Agoye will be joining me today to make this episode impactful. So, let me give you a brief about Dr. Kemi. This is what she does. On her own, this is what she does. She's a medical doctor. She's a public health practitioner. And so she has a lot of interest in community health, maternal and child, and adolescent sexual and reproductive health. That is why most times you see her, admonishing girls, training girls, and making sure that girls are okay. She's done so many programs of menstrual health and menstrual hygiene by herself, and sexual and reproductive health. Don't forget to send this link to friends and family so that they can also enjoy the knowledge that we're going to pass across today. Be also aware that you can ask questions on the chat box. So ask your questions. The questions will be sent to us, and we'll be able to ask Dr. Kemi Agoye. I also want to say that we have a Telegram page that you can also be a part of. The link will be shared on the chat box so that you can be one of those people, that can access some of those information that we give freely to ensure that people are fine. Our job is to promote the general well-being of the people. So without wasting so much time, I think that we can start now. Dr. Kemi, are you ready?
Yes, I am. I hope you can hear me loud and clear.
Yeah, we can hear you.
Okay.
So, Dr. Kemi, let's start from the topic. What is menstruation, and why is it called monthly period? What is menstruation? Why is it called monthly period?
So, menstruation is a natural, normal physiologic body changes that allows women to shed their monthly uterine lining, and it comes out in form of blood tissue from the vagina. So menstruation is just the shedding of the uterine lining, of the endometrial lining, and it happens monthly. Okay, so why it happens monthly, or why it's called monthly period, is because menstruation itself is a part of something called the menstrual cycle. So the menstrual cycle is a cycle that is natural and normal for every woman in the reproductive age, and is hormone driven. So the menstruation starts that cycle, and the menstruation has the menstruation itself, has the ovulation period, has the safe period, then the stop, then the menstruation again. So the beginning of every menstruation starts that menstrual cycle, and the beginning of another menstruation starts another cycle. So menstruation is just shedding of the uterine line, as opposed to different things that I've heard girls say on the field, like is menstruation is a sign of unwellness, is washing off of the womb, cleansing of the womb, or washing off of undeveloped babies. You know, you hear a lot of things. But I just try to let them know that it's a natural physiologic process that every person, every normal woman in a reproductive age should go through, and it's just the shedding of the uterine lining of the uterus of the womb. So that's what menstruation is.
Okay, so you said it's natural physiological process for everybody that is in the reproductive age. I want to ask a question. Is it possible for a woman not to go through menstruation, or does that make that person does it, if someone is it possible for someone not to go through menstruation all his life? Is that an abnormality?
Yes. There are a lot of congenital abnormality. Most times those type of cases are seen in people with congenital abnormalities. So congenital abnormalities are abnormalities which the woman is born with, like the person is born with. For example, people that maybe their uterus did not develop, or they have deficiency, or their uterus developed or did not develop well, or they have some form of organs or part of their uterus missing. So there is the cornea uterus. There are some people that, you know, okay, so when I do this thing is usually a practical teaching. You have models showing girls what the uterus looks like. So if I'm explaining, I used to say uterus looks like a woman standing with her two hands stretched by her. So she's standing like a T. So the two hands she's stretching represents the fallopian tube, like holding on to ovaries. Then our body represents the uterus. Then our leg downward represents the cervix to the vagina and the vulva. So the part you see outside of the reproductive organ of a woman is the vulva into the vagina, then the cervix. So the uterus has like an inverted triangle shape. And what causes menstruation is that the base of the inverted triangle, the lining there, when it has taken up over the period of ovulation and expecting a fertilized ovum to come and attach to it, but that did not happen, then that prepared ground starts to shed off. So when it sheds off and drains down through the cervix into the vagina. So that's what you now see as blood and tissue coming out. So for some people, maybe that space in the uterus did not develop. They can't menstruate. Or some people that there's something called imperforate hymen, but that can be corrected. For example, maybe they have the uterus, but that's the passage that allows the blood to go down through the cervix to the vagina and you see it out is not opened. That can also cause the person not to menstruate. You understand? Or the person has some hormonal issues. So there are a lot of processes that goes on, physiologic processes, anatomic processes in the hypothalamus, the pituitary gland, that trigger some of the hormones that is produced, that triggers, they call them the hormones of reproduction. That's estrogen, progesterone, or something occurs, and those hormones are not triggered by the brain to be produced. So there are situations where some people do not menstruate, but I'm just trying to tell you that there are cases of either endocrinology problems or congenital problems or anatomical problems.
Okay, so thank you, Doctor. Thank you, Dr. Kemi. So that will make me ask this question. So I once met a mom that the child started menstruating at 8 years old, and she was so angry. In fact, it became a prayer point. And our fear was funny. Our fear was that if she shed all the eggs in her womb before she gets married, then she might not have babies. And I'm like, oh, so what is the age that is relevant, that a woman should be concerned when the child starts, or should be concerned when the child has not started menstruating? Because for this woman, it became a lot of issues, and we had to try to now, help her out, to say that, okay, the number of cycles that a woman has in her lifetime is so much that this child will still have a baby. Because she was like, oh, if she starts at 8, what happens if she wants to have a baby at 35? Will there still be eggs in her wombs and all that? And it was crazy, and it was very funny. Now I'm laughing, but then it wasn't funny because
I can imagine.
I couldn't help myself.
Yeah. Okay, so the thing about menstruation, okay, menstruation is not just a standalone. When we talk about menstruation, we talk about menstruation, menstrual cycle, we talk about menarche, we talk about menopause, we talk about ovulatory cycles and ovulatory cycle. So I would just explain what this term means. So menarche is the age of onset of menstruation. Menarche is the age at which a girl and a girl child can start menstruating. And usually menstruation is part of the pubertal stages for girls. And actually, according to research, according to books, even till now, the menarchal age is 8 to 15, actually. So the lowest age, the lowest, everything in medicine is usually a range. There is no hard and fast truth, is a range. So the normal range of menarche for any girl is 8 to 15. If it's before 8, is when you now start worrying about precocious menstruation. I don't know if you've heard of that. There's something called precocious menstruation or precocious puberty, where a girl starts showing secondary features of puberty or starts menstruation before the normal age that she should. But 8 is actually the lowest range of normal age a child can start menstruating. So she starting at 8 is not abnormal. It's normal. It's just that it's on the lower range, or is the lowest range of normal that there is. So 8 to 15 is the normal range of menarche. It's just that we now have an average of 12 to 13. Like most people tend to start by 12, 13, 14, thereabouts, maybe because of growth or some other environmental factors. But 8 to 15 is a normal age of menarche. Now, going to menopause. So menopausal age has shifted over time. At some point, menopausal age could be as much as up to 60, but currently menopausal age is an average of 45, 50. So yes, as at 2016, it was age 45 to 55 was the range for menopause, and is dropping. Like as the year goes by, it drops because of some environmental factors like our diet, our lifestyle, and stuff like that. So it keeps reducing. But as of now, average age is about 50 thereabouts. So, and it is set already, like I said, the range from menarche to menopause, that reproductive cycle is set, because when a child is born, she's already born with all of the ovaries, like is set. A girl child is born with all the ovaries she would have and is in hundreds of thousands. So that mom that is worried or bothered, she shouldn't be bothered, because some people can even still be menstruating at some age, but their eggs are no longer viable. That even if at the age of 40 something, she's still menstruating, the eggs she has at that point are called their eggs. We don't That's why they don't always advise women over the age of 35, 40 to get pregnant and start giving birth, because they tend to give birth to babies that have Down syndrome and some other syndromes, because the eggs they have at that age is already going towards you understand. So for that kind of mother, I just need to explain to her that the ovum that the child has is enough to last her for that period of time. It's enough to last her for that period of time because it is set already. And so far she didn't start before 8, she's fine. And menopausal age can still range up to like 45, up to like 50. But there are cases where some people have menopause at a younger age. Like I said, you can have some background conditions, premature ovarian failure, and stuff like that. But normal range, she's fine.
So thank you very much. So for every mom that is concerned out there, your child is 11 or 12 and she's still not menstruating, we now know that between the age of 18 to 15, that's when menarche starts, and there's no reason to worry about it. And if a child starts before or after, that's when you can now have concerns raised and seeing a doctor. You also said that there are some women that will not menstruate at all, and that is because they have some congenital illnesses or anatomical illness, or their hormones are not producing, so the hormonal imbalances that could make a person not so. So should in case anything like that happens to anyone, it's now now important for such people to seek help. Thank you very much. So let's look at premenstrual symptoms. What are the premenstrual symptoms that you want us to know about? I know that when I was young, sometimes because we didn't really know how to calculate our menstrual cycle. So at a point you just be afraid, you feel that you're having some temperature and all that, and when we're in secondary school, we are so scared that your dress will not be stained. So you're practically carrying something as an emergency all around. And I think a lot of women still do that. I still do that till now, because I remember that some people were really, really laughed at. So I really don't want to be a part of that. So even up till now, I still carry something around in case there is an emergency. I still carry at least a piece of sanitary pad. So can you tell us some of the premenstrual symptoms, so that girls and the younger ladies on this platform can, once you start feeling that, you now start preparing yourself?
Okay, so like I said, the cycle is a cycle. It continues. It keeps going. After one menstruation, ovulation starts. After ovulation again, your body is preparing to shed again, menstruation. So it's a cycle. It keeps going. But premenstrual symptoms are just a constellation. So it's premenstrual syndrome that are a constellation of symptoms. And these symptoms usually are just emotional symptoms, behavioral and physical stuff. It's nothing pathologic, meaning it's not an illness. It's just change in behavior, in emotion, and all of that. And maybe you get some physical changes. And some of the things that might happen, some people start having their premenstrual symptoms even right from their ovulatory period, even from when they're ovulating already, when they're having their ovulation period, before they start the menstruation. That's about 2 weeks after their initial period. So by the time they are going into like the 3rd week and they're preparing to maybe enter into their period next week or the following week, they already start having these symptoms. So some of the physical symptoms, like you said, some people might have like increased body temperature. Some people might have breast tenderness. Some people might feel bloated. Some people might have headaches. So basically, all of these are just what's it called now? They are just associated with hormones. They are associated with the hormones that are changing. These hormones, they peak, they rise, they fall, to be able to ensure that that cycle is regulated and it keeps going. So when estrogen peaks, progesterone drops. When progesterone peaks, estrogen drops. So it's this rise and fall of these hormones that cause these changes in behavior in their physical bodies. So some people have breast fullness, some people have breast tenderness, some people even have as far as headache, some people start having thigh pains, thigh cramps, and some of the behavioral things you might see is maybe they can start going into mood swings. That's when one moment she's happy, the next moment she's crying. Some tend to start eating a lot. They have increased appetite. Some can even fall into depression. Some begin to have anxiety, like you explained. Anxiety is even in the normal time. My period is coming. They are very anxious. They are tensed and all of that. So premenstrual syndrome or premenstrual symptoms is a constellation. It's not just one single thing. It's different things ongoing, but they are basically just physical and emotional or behavioral changes that just comes with the cycle, and is mainly anchored on the rise and fall of the hormones of reproduction that are at work, that are ensuring that cycle is regulated. So that's
so how can it be prevented? Sometimes you have a teenager and all of a sudden the person is moody. I know the way parenting is now. You want to try to know what is happening, and sometimes you've even forgotten that this person has a menstrual cycle. I'm just in my head thinking about it now. So sometimes I'm just trying to get into their heart and see what is happening. And right now, I'd forgotten that all those things happen. Maybe it happens to me too, but maybe I've been able to control it. So I can't even, I'm just wondering in my head now that so all those times. So maybe I shouldn't have bothered myself. Maybe I should have gone to sleep. And at the same time, you don't want to say it's menstrual period, menstrual cycle issues that is worrying the lady, and you want to be sure that you are correct. Is there a way we can prevent some of those things? Is there a way a woman can manage her emotions and not allow, the moodiness to come in, and the snappiness? Sometimes your children are thinking that it's actually work. Meanwhile, it's not work. It's just the hormones in your body, performing magic on you and making you not feel excited. Is there a way we can help ourselves?
Yes. This thing you're talking about is even worse for menopausal women, because for the premenstrual symptom you have kind of like double when you are menopausal, when you're getting close to menopause, because some of these hormones, they really, especially estrogen, which is the hormone, I call it the hormone of finesse and finance, it tends to be reduced. So all of these mood changes, being anxious, having mood swings, it doubles for even menopausal women. So for adolescents, actually, the first thing first to be able to manage or know what's going on is to be aware of their cycle, for them themselves to be aware of the cycle of their bodies, for the mother also to be aware. They need to be aware. They need to be aware, because even them themselves sometimes they don't know. It's as bad as some people. Their premenstrual symptoms makes them lose sleep, lose concentration. Some of them, they just realize they're just craving very funny things. They tend to eat. They can't concentrate in school. They can't even sleep well. They begin to withdraw. They just want to stay in their room more. They don't want to talk to anybody. They're having mood swings. This moment she's okay. You feel she's okay. She's happy. Next moment she's just in her room. She doesn't want to see anybody and all of that. The first thing is to be aware. And that's what I try to teach adolescents. So during one of my earliest research, I realized that more than, so let me be specific here, just about 30% of over 400 girls had an average idea of what menstruation, menstrual cycle, and menopause was. A lot of them don't even understand what menstrual cycle is. So they know menstruation, but they don't know that there is a menstrual cycle that you can actually use to determine when next you get your period, how you can monitor what is going on in your body and all of that. And what I explain to them is you start from now. The first day of your menstrual cycle is the first day of your menstruation. So when they ask you when was the last menstrual period, you don't say the last day you finished. You say the first day you started it. That's how to first start counting. So I tell adolescents, get a calendar. If you don't get a calendar, personally, how I do mine is I get a journal, a jotter, or a piece of paper. I write 1, 2, 3, like I number 1 to 30 or 1 to 31, like a calendar. I put the month on it. So the day my period starts, I circle. So when I circle it, I keep circling for the days I see my period. Then after that, so I know from the first day I cycled, I can count till the next time I'll see my period again. So if I do that consecutively for 2-3 months, I'm able to have an idea how many days my menstrual cycle is. So menstrual cycle could range from as low as 21 days to as high as 45 days in adolescents. But the average usually is like 20 to 35 days. 28 days, 35 days. But when you count, if you count from the first day of your menstruation to the next first day of the next menstruation, that is one menstrual cycle. Then you count again from the next first day you're having to the next first day, that's another menstrual cycle. So if you count those days in between, then that is the number of days of your menstrual cycle. So from there, you can be able to determine when you'll see your period next, when you're ovulating, when you can be seeing your premenstrual symptoms. So you're not clashing things. So if it's not a period where you're meant to be seeing your premenstrual symptoms, even if the child is showing those symptoms, you know that it's not period related. At least you can rule out if it's period related or not period related. So the first thing is to be aware, to be able to count, monitor your menstrual cycle, know when what is going on in your body. That way you are able to monitor, and you can rule out if it's menstruation related, because you know what period she is at every point. You understand? And if it's not menstruation related, you also know, because you know that this period cannot be menstruation related. So the first thing is to be aware. So home remedies, the quick home remedies you can do for premenstrual symptoms, actually, depending on the type the person is having. If the person is having cramps, quick home remedies, you can get a warm water bottle, you put hot water in it and just place it over the uterus, because the uterus is contracting and all of that. The warm bottle can help to relax the muscles. So when the muscles are relaxed, it kind of soothes the pain. You can have a warm bath. You can use OTCs, like some medications that you use. But my own problem now with with just using all these paroxysmal and co is because they can ulcerate the stomach. Chronic use of NSAIDs can cause ulcer on the long run. So instead, I would just prefer to use antispasms like Buscopan, that's hyoscine and stuff like that. So quick home remedies. Some people, paracetamol, as little as paracetamol is, it works for them. Some, a little bit of paracetamol and caffeine, that's cocodamol, just all this. But cocodamol is not OTC, I do not think so. But some of these analgesics can easily help to stop the pain.
Cocodamol is not OTC.
Yes, I know it's not OTC. Help. And another thing is, during those periods, if whatever it is they are craving for, like in my own house, anytime you get to my fridge, you always find chocolates there, because you never know when the craving will come. So just indulge them at that point. It's not every time. It's just like once or twice in a week. So you should indulge them when they are moody. Sometimes if you study a mood and you think she wants to be left alone, sometimes just leave them alone. When they are out of that mood again, you are there to be like, oh, so how are you feeling now? Are you feeling better? Do you want ice cream? Do you want this? Do you want that? Do you understand? So just try to be aware. The bottom line is be aware. You be aware. Be aware. Yes, that's just it.
Thank you, Dr. Kemi. And I think mothers on this timeline and parents and even individuals need to be aware. Sometimes because we work so hard, we're so busy, we've forgotten that our hormones can actually be playing tricks on us too. So now that we're aware that menstrual cycle, some of us have known this before. We know symptoms when we're younger, and now that we're older, we feel that maybe you've mastered it. So each time you're having symptoms like that unusual moodiness, you're depressed and all that, please, let's try to check ourselves out and check it's not the menstrual cycle that is playing tricks on us. When we have children that are moody and we can't understand them as well, knowing their menstrual cycle can help. And knowing handsets, one actually use hot water bottle and put it around the uterus. As the uterus is contracting, it can help. And maybe a product like she said, a product like Buscopan. Although I'm not advising every patient, but these are home remedies that help their whole TC. They are over-the-counter medication, and one can actually go in and buy. I also want to ask a question. So I used to have a system. I'm just thinking now that I didn't even try to verify that point. If a lot of sugar.
At some point, can you start the question again? Hello. The line is breaking. I can't hear you anymore. If you can hear me.
Okay, can you hear me now?
Yes, please, I can.
What is the impact of sugar? Consumption of sugar before the menstrual period on the pains people have?
Okay. At least last I checked, research-wise, there is really no scientific correlation. I think it's just the mind and just one of those cultural, environmental things we have grown up with. Because really, what causes menstrual pain is the prostaglandin that is released during the whole process. That's what causes menstrual cramps and pain. So there's prostaglandin release, the uterus is contracting and all of that. That is what's causing the pain. Now, sugar, again, like I said, there is no scientific evidence or there is no scientific basis to it that sugar increases menstrual pain. And another way I would explain it is I have people that they take sugar while they're on their period, they're drinking all the Fanta, eating all the chocolates, and they don't have menstrual pain. And there are some people that, as much as they dodge the sugar, they dodge it so much, they still have a menstrual pain. So I don't, not that I don't, aside from I don't think, there is really no scientific basis to prove, there is no scientific evidence to prove that sugar has anything or sugar correlates to menstrual pain. I think it's just one of those things we have grown up with. But another thing I tell people, because in medicine, we say never say never in medicine. Medicine can be very funny because what pertains yesterday might have changed today. But another thing I just tell people is, again, be aware of your body, be aware of your cycle. Do what works for you, because every woman is unique. Every woman's body, every woman's cycle is unique. No two persons, no two bodies are exactly equal. As much as we are in this world, everybody's body is different. So know what works for you. If you know taking sugar increases your menstrual pain, then abstain from sugar during that period. If you know taking sugar or not taking sugar doesn't change anything, do what makes you happy. But there is no scientific evidence, there is no scientific correlation, as of last I checked, that shows that sugar is what causes menstrual pain.
Okay, so I think this is a case of someone saying antibiotic drains their blood, because there is nothing like antibiotic drains people's
Like
blood.
I hear
So I
a
think
lot
this,
of
yeah. So I think this is another myth that sugar. Thank you for helping us with that. Thank you for helping us with that. Then let's talk about the shorter days. When I was in the university, although I cleared it, that there was a time people were saying that people that have their period for just 3 days or 2.5 days, that they are not likely to have children when they had it. I think when I was in secondary school, and then my period, the period days was just three days, and everybody was having 5 days, and some people were having 7 days. I was just the exception, 3 days. There was no Google then, so there wasn't any way I could check. If I want to check, I'll have to go and look for big textbooks to read. And the thoughts actually haunts me for a long time. I was thinking I wasn't going to have babies because I just felt, it was a part of me. Then my cycle was 18 days. It wasn't 21 days. It was 18 days, and it was very short. So 3 days. You know the way it is, because you're always asking someone to help you to check if it's staying or not. So I'm always asking that question frequently compared to other people. Of course, I know that some people might be going through this. I just need you to help clarify. I've clarified really. So I just want you to clarify that the number of days, the impact, if it's 3 days or shorter, does it have any impact on people's ability to conceive in future? And you also said it's between 21 to 45 days. For beginners, mine started from 18 days, and it became 21, then it became 24, and now even up till now it's 24, but I started from 18. I don't know what you would have to say to girls that might have this cycle and their parents are also bothered about it.
All right, so it's different facets. Let's start from the cycle part. So for menarchal age girls, that is girls that are just starting, girls within their first, second, third gynecologic year. That means like 1, 2, 3 years after they started, their periods can be irregular, in quotes, meaning it can be lesser, it can be more, it can be as small as that 18 and stuff, because it's a new process, their body is just starting, so it takes time for it to regularize. So for beginners, really, for girls that are just starting, for girls within that menarchal age, even up to like their 7th gynecologic year, that means up to like 7 years after they've started, some people's body are just able to regularize it. So for people that are starting, it's normal for them to either see it less frequently, at lesser days, before the body warms up to the process and takes a more regular pattern. So that irregularity at the initial beginning is absolutely normal. So and I would like to correct something else. The range for menstruation is actually 2 to 7 days, not 3 to 7 days.
Okay.
2 to 7 days is the normal day. Is the normal menstruation range, is the normal range for having your period is 2 to 7 days, not even 3 to 7 days. So you can now say the person has hypomenorrhea or AUB or DUB when the person has more than 7 days or less than 2 days. So if you have your period for 2 days and it comes regularly, it's absolutely normal. So it's 2 to 7 days. It's just that you have a general average of like 3 to 5 days. You understand? Just like the way menarche is 8 to 15 years, but you have a general average of like 12, 13, 14. So for menstruation is 2 to 7 days. It's just that there's a general average of 3 to 5. So for menarche now, that is for beginning menstruation, is when the child is now 16 and the child has not started seeing her period. That's when you can now say, oh, this child has primary amenorrhea, meaning the person has not started menstruating. It's from the age of 16, you can say that person has that. So it's when somebody also is bleeding for less than 2 days and bleeding less than 30 mils of menstruum. So menstruum is the blood that comes out during menstruation. It's called menstruum, or the blood you see. So if the person is bleeding less than 2 days and bleeding less than 30 mils, that's when you can say the person is having hypomenorrhea. That means the person is bleeding less than the person should bleed. Or the person is now bleeding for more than 8 days and bleeding a lot. You can now say, oh, the person has menorrhagia. That is excessive menstruation, excessive bleeding. Or it could be a DUB, that's dysfunctional uterine bleeding, or AUB, abnormal uterine bleeding. But an abnormal uterine bleeding or irregular bleeding is normal within the first to 6 years of starting period. Actually, it just takes time for the body to warm up to the process and get a regular pattern. Do you understand? So, and for people that are saying that bleeding for 2 days or 7 days, no, it's a cycle. Every woman is different. Everybody is different. Some people bleed for 2 days. Their cycle is for 21 days. They're fine. So far, it's within the normal range. Some people bleed for 7 days. Their cycle is in 35 days. They're fine. So far as within the normal range, and that is how it usually is. There is no abnormality to it, there is no excessiveness to it, it's just within the normal range. So the number of days you bleed for, or the number of the length of your menstrual cycle, so far it doesn't exceed the normal range, it doesn't affect your fertility. Fertility is not dependent on the number of days of your menstruation or the length of your menstrual cycle. So far is within the normal range.
Thank you, Dr. Kemi. I thank you very much. Thank you very much for this. And you also made a point, which was part of the question that I was going to ask before, that when the period exceeds 7 days and the bleeding, meaning that spotting after the period does not count for bleeding, for menstrual period.
No.
So when the bleeding is like the normal bleeding and it exceeds 7 days, that's when parents and the child should be bothered.
Yes.
But if it is spotting, one might not actually be bothered. So when people are saying this menstrual period is continuing, we need to be able to ask
if
it
is it actual bleed. Is it just spot? Is it just stain on the pants, or you actually have to use pad to hold it? Okay. Or do you have to change pads? How many pads did you use? Because when we are quantifying menstruation in the clinics, what we want to ask is, okay, so what type of pad do you use? How many do you use? How many pads do you use in one cycle? They're telling me you're using up to 4. I know there's something is wrong somewhere. Okay, some people can be very finicky and they say, oh, I change every hour, but you don't change every hour. You do the 8 hourly and you're using up to four packs of pads. At least they come in 7, 8. For the ones that come in 7, 8, then I know something is wrong somewhere. But you change your pads 2, 3 times a day, 4 times, that's fine. But you're telling me you change up to 10 times a day. then I know something is wrong. Do you understand? So that's the way we like subjectively quantify what is excess, what is within normal range, and all of that. And when you actually be asking, is it totally soaked or is it just stained? Is it the one when you remove it is dripping, the blood is dripping from it and stuff like that. So
Okay.
those are subjective ways you can actually know, okay, this is too much.
Okay. Thank you, Dr. Kemi. I know mothers and individuals on this timeline are also listening to that. So you can actually quantify the blood by not just by asking for the number of sanitary pads and how soiled the sanitary pads. Thank you very much. So how about women? How about women that use contraceptive and all of a sudden there's a change in the volume of blood during their menstrual period? Should they be concerned? Should they be worried? Especially when women, I know that I was telling someone about IUCD and said, no, they said that that the bleeding will be too much, that she's not ready.
IUCD is even one of those that is not hormone impregnated, it's just copper T, it's not even hormonal. Okay, so this is one of the issues we used to deal with at family planning clinic, because I work in a family planning clinic. Women will come, oh, I started using Jadel, I've not seen my period for this. And one thing I take my time to do for women that come for family planning, women, girls, whatever that come for family planning, is explain whatever all of them, the pills, the implants, injectables, and the IUCDs. I explain to them their mechanism of action, because it's their mechanism of action that will determine the type of side effects they will have. And I tell people that it's family planning. It's not a part of your body. It's not like your nose or your eyes. It's something new that you are introducing into your body. So your body needs to adapt to it, needs to accommodate it. Your body needs to, what's the word now? Needs to get used to it. So it's during that period that you might see some of these side effects. So I think, but if whoever gave them this family planning has gone through that process of doing inclusive counseling, it's called inclusive counseling for them on the possible side effects of whatever method they have chosen, a lot of this will not be coming up. So for the ones that sometimes alters menstrual cycle are the ones usually that are hormonal. Those are the pills, POPs, COCPs, the injectables, Depo, Nosterat, the implants, Jadel and Implanon. And that's because they are hormonal. They work with the hormones. And like I said earlier, that the menstrual cycle is a hormonal driven cycle. It's driven by hormone of reproduction, majorly estrogen and progesterone, but there are other ones. There's the LH, FSH, GRH, all of those. But the major ones is the estrogen and the progesterone. And estrogen is the one that start working immediately your menstrual cycle stops, and taking up the wall, preparing the uterus for the next attachment or the next pregnancy. If it doesn't see that, it crashes, progesterone comes up and all of that. So the whole point is, because there is already a natural way that your body programs the way those hormones would rise, would peak, fall, the other one will kick in, peak, fall, and all of that. And you introduce a family planning that somehow now comes to, regularize those hormones. Yes, alter those hormones so that you don't get pregnant, so that you don't ovulate and stuff like that. There is no way it's not going to affect the outcome or the work those hormones are doing. Do you understand what I'm saying? It's the hormones that drive your menstrual cycle. So if you take something that would destabilize or alter those hormones, then the outcome of the normal work those hormones they usually would do also would be altered. So menstrual irregularities or change in menstrual patterns, that's what we call it. Just say you might have some changes in your menstrual cycle. Some people might bleed. If they bleed for maybe 3 days before, they can bleed for up to 5 days. Some people, if they bleed for maybe 6 days before, they can start bleeding for less. Some people, their menstrual cycle can maybe 25 days, it can increase, it can do you understand? Be prepared for it. The whole thing is just counseling them ahead and making them know that it's just a normal part of the side effects that comes with using family planning. And that is because they are hormonal, and the menstrual cycle is an hormone-driven cycle. I think that
Thank
is
you very much. Thank you very much, Dr. Kemi. So for everyone on this timeline attending this webinar or that will listen to it afterwards, if you're using any contraceptive, it could actually affect the response of your body and the volume of blood that will be shed during your menstrual cycle. So how about this, Dr. Kemi? So I know that when we were in secondary school as well, we were debating the color of the menstrual period, of the blood, of the menstrual, and we used to discuss the color and the smell. And I don't even understand us then. Really, I don't understand girls. I don't understand. And
to talk about
somebody that it's somebody that I just know some people were lying now. I just know some people were lying because some people say that it smells like they smell like chocolate. I really, and it's somebody was just telling bubbles for us, and some other people will not be able to say how it smelled because somebody is telling you it's smelling so fantastic and it feels like something that can be eaten. Like, no, this is not how mine smell, and people keep quiet. So what smell or color should people be concerned about? I know that it's a waste product really, and it cannot smell as good as chocolate, but when should we be concerned? What smell? Or does it affect the smell? Does it affect the time you're changing as well? I just want you to
the smell. Okay, so so what is menstruum? Like you said, menstruum is just blood. Is waste product, not waste product. It's just your uterus. I don't even like to call it waste products. I just say is your uterus, your uteral lining and endometrial lining shedding off. So it comes out as blood and tissue. So if you take a sample of a menstruum and you check it under microscope, what you will see there is just blood and tissue, like tissue samples from the uterus and blood. So basically, it's just blood. So it smells like blood. How blood smells? It smells like blood. There is nothing. But because it's blood is a proteinous product, meaning is a life protein product. Blood is living. It's a living thing.
Wow.
Tissues are living things. Yes. So when it's fresh, it's just like your meat. Yes, good. Let me use meat for example. If you buy your meat in the market, if it's fresh, it's bright reddish, it's joyful looking. But if it has stayed for so long and is already getting bad, meaning coagulation process is setting in quotes and all of that, it begins to have this darkish brownish reddish color, and it begins to give off this smell, this odor of like something is rotting. So it's the same thing with blood. Blood it's just like the blood of it's just like when you buy meat in the market, like I just explained. If it's fresh, it's fresh blood. If it has stayed for long and is already going through process of degradation or denaturing, then it begins to give off the smell of like maybe meat that is degrading or that is going through the raw process and all of that. So smell is the same thing for menstruum. So like I said, is blood and tissue. So it's just fresh blood smell, fresh meat smell. That is if it has any smell. But if it now takes time, maybe person does not change your time, or somebody use one pad for one day or the whole day. By the time person removes the second day, of course, it won't be smelling nice. It will actually give off that smell of it's degrading. You understand? It's degrading, and the color will not be it won't be fresh, bright red. Do you understand? It will be darkish, reddish, brownish, reddish. Yes. So that is what it is. So when you should be bothered is when you're not having actual foul smelling bleed. Now you should be bothered. But aside that, it's just normal blood and all of that.
So thank you, Dr. Kemi. So for everyone out there, the blood, it's blood. So she even said you shouldn't say that it's waste product.
No, it's not. It's just blood.
The blood of an animal is the life of the animal, so it's living, and that the normal smell of blood is the normal smell you see. It's when that normal smell at that point is coming out, you experience a foul smell. That's when you should be bothered. So it's the color of blood. The time you're changing it or changing your sanitary pad could make it look as if the blood has turned brownish. Of course, the blood becomes denatured after a while. So don't be concerned. So when someone is telling you that it's smelling like chocolate and or fresh bread, just know that person is just telling a lie because the smell is the smell of blood and nothing else. So if you observe that at the time the blood is coming out, it's not looking like blood, or the smell is a foul smell, then you should be bothered. That is when you should see a doctor. So how about when parents compel their children to take blood tonic? Does the body have the capacity to reproduce the blood lost during menstrual period, or do you advise women to be on hematinics, that's blood tonic and blood capsule, because of this monthly period, monthly cycle, menstrual cycle, or the body can actually reproduce the blood, so we shouldn't bother?
Again, there's no hard and fast truth to it. But what I tell people about hematinics is the basis to use hematinics is if there is actual evidence of a person having anemia. Anemia is reduced blood in the body, or shortage of blood in the body. If the person is actually, like, you can see with evidence that the person is anemic, and maybe the anemia is now secondary to menstrual bleeding. But your normal menstrual period should not even cause you anemia, except you are excessively bleeding, or you're one of those people that would have menorrhagia. Okay, people that have menorrhagia or that have DUBs or AUBs can tilt into anemia. But for your normal menstrual bleeding, it shouldn't tilt you into anemia. And it's when you have anemia, you should use hematinic. Okay, some people just like to use blood tonic. Again, it's just like that sugar and menstrual pain. Using blood tonic, if you feel you want to use, okay. If you feel you want to use hematinics, okay, except you are objectively anemic. That's when it is compulsory. But there is no rule that says that for every cycle you have, for every menstruation you have, you should take hematinics or blood tonic. No. But if the person is physically, like, the person is pale, you check the conjunctiva, you check the sclera, the person is pale. Of course, the person would need hematinics, or the person is already showing feature of an anemia that can maybe lead to anemic heart failure. Good. The person can take hematinics and all of that. But those are in extreme cases. Actually, it's not for the everyday normal menstruation. Usually, you see that people that have menorrhagia, that's some underlying pathology that is making them bleed, and the bleeding does not stop. Besides that, it's like I said, it's a natural physiological process. The body can handle it. The body can take care of it.
Thank you very much. So all the mommies forcing us to take blood tonic because of our normal period. Please don't force us to take blood tonic again. But if it's excessive and the child is anemic, then we can advise that the child takes hematinics or blood tonic. But ordinarily, if it's just the normal monthly period, Dr. Kemi is saying that those are also some of the myths that we need to look at. They are not true. Somebody asked a question online. I'm always having serious stomachache and breast pain during my menstruation. Is it normal? I think those are meant to be premenstrual. I think the stomachache is due to contraction of the uterine walls, as Dr. Kemi said, and I also has advised that you can just use paracetamol and maybe a Buscopan for the stomachache, and maybe have an hot water bottle that you can put across your on top of your stomach where your uterus is, and that could relieve you. So I have this question as well. Is having sex during periods safe?
Okay, so keep getting this question. Having sex during period is another myth. Whether you have it during period or you have it during period, sexual intercourse is sexual intercourse. So now, having sex during menstruation now is solely and only dependent on both parties. If both of them are are comfortable with it. Because usually what they say is if you have sex during menstruation, maybe the person can catch HIV or cannot catch HIV, or the person or the guy will die, will not die, or something like that. So what I say,
or the baby will be red. The baby will be red.
menstruation does not confer any form of immunity or does not have any form of toxicity that can save anybody or kill anybody. I don't know if that my line is, if you understand what I'm saying. So whether you're your parent having sex does not mean the other party is safe from catching anything, or does not mean the other party is at risk of catching anything. Having sexual intercourse during period is the same thing as having sexual intercourse when you're not on your period. The only difference is that the vagina is bleeding at that point, probably more lubricated, but that's just the difference. It doesn't confer any immunity, it doesn't confer any toxicity. Do you understand? So it's not safe, it's not safe. Safe sex is using either contraception if you're contraceptive if you know that you are the partner using safe sex is consensual protected sex. That is safe sex. Safe sex has nothing to do with menstruation. Do you understand what I'm trying to say?
Okay, so maybe the question is, can someone get pregnant if you're having sex during menstruation? Can you get pregnant?
Scientifically, if you look at the menstrual cycle, like I said, the menstrual cycle starts from menstruation, and when you're already bleeding, the uterus is at that point is not prepared, is not ready to take in any attachment. But again, never say never in medicine. And what the person might call menstruation sometimes might just be spotting. The person might have just moved on from that phase and maybe already in another phase that is almost into the ovulation period. Again, people's body are different. Again, anything can happen. On medicine is, you never say never in medicine, but scientifically, as of today, as of yesterday, today, scientifically is not a likely possible occurrence to get pregnant when you're bleeding.
Okay. So thank you very much. So
It's even contraindicated. Sorry, excuse me, please. It's even contraindicated, not contraindicated in the sense that it's even not physiologically possible, because when how fertilization occurs for pregnancy is when the sperm is ejaculated into the vagina, goes into the cervix, into the uterus, and all of that. There is blood coming out. So the blood coming out is somewhat pushing back the sperm. So there is no way. I don't know if you understand what I'm saying. There is a counter movement. So even makes it more difficult to get pregnant during menstruation. But like I said, you never say never in medicine. Anything is possible. But scientifically evidence-based, it's not a likely possibility.
Okay. So for everybody that is asking that question, so there's a place where science might not be able to prove, but physiologically and scientifically, it's not a womb that is shedding might not be able to receive at that point. So the two might not be able to work together, except what you are saying is menstruation could just be spotting and it's not the actual bleeding. So that might be the difference. Then she also gave room for possibility and probability that is beyond
because, there's always that 1% of the population that always defies so that 1%. So we never say never.
That one in a million can help.
Yeah, that 1 in 1 million possibility. So
okay, so there's this other question that we want you to answer. So why do people have rashes after the period, and how can it be prevented? Why do people have rashes? How can it be prevented? So some of those people are saying that they even change every 4 hours, every 5 hours, they wash before they change. Some people have changed different brands of sanitary pads to prevent those rashes, and they still have rashes. So why do people have rashes?
Okay, so personally, I dealt with that at some point. I realized that mine was because I switched pad products. I was in a particular brand before, then I switched to another brand, and I wasn't finding it funny. Okay, so for people that are having rashes, this is one of two things. It's either perineal hygiene, meaning hygiene. How often do they change? Do they clean properly? Do they wash? What materials they use? Another thing is dependent upon is the absorbent they're using. That means the material they're using to absorb their menstruation. So it varies. Some people use clothes, tissue, pads, tampon, and all of that. And some people body is hyperreactive, meaning there's something called contact dermatitis, allergic dermatitis, and all of that. So it's multifactorial. It can be because of any of these reasons I have said. But like you said, for those people that they wash regularly, and not just wash. When you wash, you dry before you use the pad, because if you leave moist, the way our reproductive system is, the vagina is like in a crevice. It has many angles to it. So after washing, ensure that it's dried before you use the pad, because if you leave moist there, it can allow for microorganisms, fungal growth in between. Then it starts to cause dermatitis and all those rash for you. So if you ensure that you wash well, you dry well, you are using a good, because sometimes you have to change multiple times before you get that particular product that suits you. I had a friend that she had to move the brand that I was using that I felt was the perfect one for me. I introduced it to her and she wasn't finding it funny. She had to still change before she finally got one that was good for her skin. And if she mentioned the name of the one she was even using, it was one of those ones that I could not cope with, because I'm a heavy bleeder, and I'm like, how do you use that? But that was what worked for her, and it worked for her well. And what worked for me is different also, and it worked for me well. So you need to be able to, get that particular absorbent that works well for you, that is mild on your skin, and would not cause you contact dermatitis or allergic dermatitis. And also ensure that you change. You don't 8 hours is the maximum time limit to use one sanitary pad for. So ensure you change when you're meant to. So I'm sure if you do all of this, you clean well, you observe perineal and personal hygiene well, you use the absorbent that is best for you. You don't use ash. Also, another thing people do is using harsh chemicals in those areas, or harsh cosmetic products like soap to wash their vagina and all of those areas. That is the perineal area in between the folds of the thigh, the vagina, the vulva area, and all of that. They'll cream it, then they'll now wear pants, wear tights. It's a lot of thing ongoing. But if you're able to sort all of those and then you are still having a rash, then you probably just have allergic dermatitis and you might need to get medications for those. But besides that.
Thank you, Dr. K. Thank you. Yes, so for those people having rashes, the brand of pads they use, they might need to shop for the one that suits them. You also said that it's not just washing, one has to dry the area before using the pad. I think the place of drying is the place a lot of people are missing. So it's not just washing, it's not just changing as many times as possible. It's also drying the area so that microorganisms will not be able to grow. Moist allows microorganisms to grow very well. Oh, thank you very much. I think you've answered all our questions, and I don't know, Dr. Kemi, thank you for being a part of this. Do you have anything you like a parting words for our audience? What would you like to tell them about menstruation, about how they should take care of themselves going forward?
For me, because I'm particularly more concerned about the adolescent age group, because that's my own target population and audience. And what I tell them most time is menstruation is a national phenomenon. It's not something you should be ashamed about. You should be able to talk about it, because that's when you can learn about it. You can learn the correct things and clear the myths and misconception. So be open to learn, talk about it, and you need to be aware of your body. Don't be scared to actually take time out to understand your body. Just one of these days, stand in front of the mirror and look at your body. Some people do not know what their vaginas look like. Be aware of your body, know what your body looks like, understand your body and way it works. Then also don't be scared to ask questions. If you're concerned, instead of just discussing it amongst your friend that might not necessarily know more than you, it's always nice to maybe ask elderly people or seek help from health professionals. And don't just take things anyhow, don't take drugs anyhow, because during one of the studies we realized that a lot of girls started abusing, they self-medicate, they were abusing OTCs and all of that because of severe dysmenorrhea. So if you're having dysmenorrhea, that is serious abdominal pain or menstrual pain. If it's really bad that you cannot cope at home, then I think it's the best time to actually go to the hospital or to the clinic to get proper care for it. And if you're having premenstrual symptoms, just know what works well for you and take care of yourself, be a happy child, ensure that you're not always grumpy. And if you have questions, ask, and discuss, because that's the only way you can learn. I think that's basically it.
Dr. Kemi, a question came in now.
Mhm.
What happens if a child has a normal regular period, or someone has a normal regular period? The person is not sexually active, but the
Okay.
period gets missing.
Okay, so different things can cause it. Different things. Different things as little as stress, as little as change in diet modification, as little as obesity, as little as anorexia, bulimia. So I don't that age range, a lot of things happen. Sometimes most of these girls, some of them be like, oh, I want to be skinny, I want to be, so they stop eating, and they don't know that all of these things have other effects on their body. So change in eating habits, stress can actually cause menstrual period to cease. Then more intense things like maybe having hormone issues, having endocrine problems, having some other underlying conditions like having polycystic ovarian syndrome is also within that age range. Having what's it called now? Some chronic conditions like diabetes. There are some chronic things that can cause menstruation to cease. So I tell mothers, when your daughter is able to even come up to you in the first and say she can't see her period, you notice the first thing is not to always
Pregnancy.
point fingers that she's pregnant. She might even just be having premature ovarian failure, and for all you know, that might be a saving grace to quickly catch it and quickly do whatever it is and quickly intervene to save or salvage whatever is left. So a lot of things can cause menstruation to stop, not just pregnancy, premature ovarian failure, PCOS, stress, weight loss, weight gain, rigorous exercise for athletes, all those girls that maybe run for their school, play footballs and stuff like that, rigorous exercise, anything that just causes a rustle for the physiologic state of the body tends to affect the menstrual period. Doesn't necessarily have to be pregnancy, actually.
Thank you, Dr. Kevin. So, for every mother out there, if your daughter comes out, or even you as a mom realize that you don't have you are not seeing your period, if you're not sexually active or the child is not sexually active, pregnancy should not be the first thing that runs through our mind. That might be an indication to tell someone to slow down, especially when the person is trying to lose weight, the person is active physically, or the person is going through stress. It could also be some hormonal or physiological problem that you are given the reason to check on time. So before beating up that child, before calling everyone around you that your baby is not seeing seeing her period and she could be pregnant, because I think sometimes parents also have trust issues, and so that color their sense of judgment. So please, let's seek help. She could be a teenager, but if you know that your teenager is not, you can't even say that the teenager is a bad teenager or something. Just make sure that you are concerned in a way that could solve the problem. So thank you, Dr. Kemi. Thank you for helping us to know that menarche starts from 8 to 15. So if your child is below 8 or above 15, and the person has not seen his period or saw the period earlier, that is the only time you should be concerned. Also, thank you for telling us that it's between 2 to 7 days. I had that problem as a young child, because people were saying that because it's 2 days and it's because it's 3 days and I have 18 days, that it might affect conception. But you've already made us realize that if the first few years, the first, and you said gynecology years, the first 7 years of a child, the body might be trying to adjust to get to understand this new state that the body requires to function. And so the child might not have it regular, the child might not have the days might be shorter, but if it's 2 days and not less, it's okay. And if it's 7 days and not more, it's okay. And we need to be able to differentiate between spotting and real menstrual flow. So if your child is saying that she's having the period continues, please try to know that it is not, try to know to differentiate between spotting and actual flow. And one of the ways we can do that is to quantify the volume of blood, the menstrual, by asking questions about the frequency of change of sanitary pad and all that. So that could help you. We also are able to realize that sometimes we've forgotten that there is something called premenstrual period that could make people moody, that could make people go into depression, have sleepless nights, cranky, and all that. And so instead of just saying that this is a teenager problem, or even for ourselves, snapping at our children, being erratic around us, we should try to help ourselves by being aware of our cycle and knowing that whatever is happening to us is not as a result of the premenstrual symptoms, but it could be, once you identify that it's not premenstrual symptoms, then you can now seek help and try to modify that pattern. So before you tell your child and tell them, be sure that it's not premenstrual period, so that you do not miss what you should take care of. You've also advised everyone not to just use drugs indiscriminately.
Yeah.
While it's new to use hot water bottles for as home remedies and use maybe paracetamol, people shouldn't go all out there and take medication anyhow. Thank you very much. You also told us about rashes, and that's for everybody that have rashes, concerned about the fact that they have rashes. The hygiene must be top notch, and one of the parts of the hygiene that people could be missing is that they do not dry before they use the sanitary pad. So if you wash very well before changing your sanitary pad, make sure you have dried. And if you've tried everything, it could actually be sensitivity. If you know that your skin is very sensitive to, your body might actually be sensitive to the sanitary pad. Thank you very much. The contraceptives you use as a way of playing pranks on the monthly flow as well, we need to be aware. Thank you very much. I want to say thank you to everyone that has logged in to enjoy this webinar today. I want to say that without you, you are the one that keep us going. Without you logging on all the time to watch this webinar, we wouldn't continue. So thank you for encouraging us. I hope we have added value to you. And thank you and please don't forget to share testimonies. If this webinar has been a blessing to you, if you've learned something that you could share with people, please share the link out, share the link of this webinar to people to also, listen to this. I've really been educated today. So share the link to people so that they can also be a part of this. We need to correct some wrong information out there. And one of the reasons why we're doing this is to bring experts to talk about those things that people just those information that are important, but people just play with it. So please share the link with people, and don't forget to follow us on our social media pages, wellness_care. Be the first set of people, to get notifications on our products, on our services, on every information that could promote your well-being. Wellness is all about the promotion of our well-being. So be there as we send this information out. On our next webinar will be on the 11th of September, by His grace. It's going to be a Saturday. It's going to be by 10 a.m. too. We're going to be talking about preparing for menopause. Some of the problems that people have as mothers also could actually be because they are preparing for menopause. You are 40 plus and you're like, it's not yet menopause, so you don't know that this moodiness, like you said, the premenstrual symptoms is times 3. You don't know that. You don't know how much impact it has on your concentration, your productivity, and all that. So we're going to be bringing another gynecologist to tell us how we should prepare for menopause and what we should look at by His grace. You don't want to miss this. So until then, I want to say, I want to leave every one of us in the hands of our Creator. I pray that He keeps us and give us the grace to enjoy all-round wellness. Thank you very much. Thank you and I want to say thank you to the wellness crew as well. Thank you for being a part of this. Thank you. So see you next month by His grace. Thank you, Dr. Kemi.
Thank you for having me.